Hello, my name is Prayer Carter, and today I will be discussing my planning and intervention video presentation. Okay, so today my intervention will focus on the community problem regarding the disparities in the maternal health care for Black women. So, Black women in the United States face significantly higher maternal and infant mortality rates compared to white women. This is regardless of income or educational levels. According to the CDC, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. These disparities stem from systemic racism. We have implicit bias in healthcare and lack of culturally competent care and limited access to quality prenatal and postnatal services. So the intervention that I came up with to mitigate this problem is the Community Doula Tech Access Program. For short, it'd be CDTAP. This intervention is designed to increase support for Black birthing people by expanding access to trained community doulas and integrating user-friendly technology to bridge service gaps in maternal care. Okay, and then some of the goals for this intervention. Goal number one will be to increase availability of culturally competent birth support for Black families. With the technology with this goal will be the platform will match clients with trained doulas based on language, culture, and specific maternal needs. For goal number two, it is to empower Black mothers with education and continuous support. The technology used for this goal would be interactive learning. So we'll have modules that focus on videos, articles, and quizzes within the app that will educate users on maternal health, birth plans, postpartum care, and infant health. Okay, now we will discuss the objectives with the intervention. Objective number one will focus on the technology tool. So we'll utilize a HIPAA compliant case management and communication platform such as CareLogic. This system will schedule virtual and in-person doula sessions. It'll offer on-demand educational content, and then it'll also track user questions and wellness check-ins. For objective two, we'll focus on ethical use and privacy plan. So clients will review and sign a digital informed consent agreement explaining one, the scope of doula services, what personal data will be collected, and their right to opt out and delete their information at any time. And then objective three will focus on monitoring system for ethical standards. With this objective, we'll have user engagement, we'll have consent compliance, and then we'll also have doula client communication frequently without assessing content. Okay, and then when the intervention, the target population for this intervention, Community Doula Tech Access Program will be specifically targets for Black birthing people, so including pregnant women, teen mothers, and LGBTQ individuals in undeserved communities who are at risk for poor maternal and infant health outcomes. Okay, and this intervention aims to address many community needs. So for one, culturally responsive doula support. Two, it will expand access through technology. It provides health education and empowerment. It'll provide continuity of care and advocacy, and also community involvement and empowerment. Okay, and now we will discuss some of the key components and activities of the intervention. So, one, doula recruitment and training. So, some of the activities that go along with this component will be partner with local organizations and community college to recruit diverse doula candidates. We'll also offer ongoing supervision, peer support groups, and continuing education. It's bigger. Another key component would be to develop and deploy a mobile health app, the mHealth app platform. So with this, we'll collaborate with app developers to ensure the platform is user-friendly, it's secure, and accessible on various devices. We'll also ensure to translate content into multiple languages and include audio features for low literacy users. Another key component is going to be direct doula services. So again, this will consist of virtual and in person. So some of the activities with this component will be offer prenatal visits focused on birth planning, stress management, nutrition, and navigating healthcare. These services will also be used to attend birth, so this could be virtually or in person. And then we'll also conduct postpartum follow-ups on mental health, breastfeeding, healing, and infant care. And then our fourth component will be health education and empowerment. And then some of the activities with this would be to host a virtual peer support groups led by doulas to encourage community connection and shared learning. Okay, so when it comes to the resources for this intervention, we will need staffing. So some of the staffing will consist of a doula team. We'll also need a program coordinator, a technology manager, a community liaison, an evaluator, and also we will put together an advisory board. We'll also need funding for this intervention, right? So we will need funding for personal salaries. We'll also need funding for training and certifications, and also marketing and outreach, and then also for evaluation and reporting. Some of the potential funding sources for this intervention will be federal and state maternal health equity grants, and then also local hospital systems and Medicaid innovation pilots. And then for the materials for this intervention, we will need mobile technology and software. We'll also need training materials. We'll need client support materials, and then we'll also need office space and supplies. Okay, and then when looking at the supervision for this intervention, for one, we will need clinical and programmatic supervision. So this will be navigating complex client needs and then also addressing emotional challenges, and then also reviewing cases to reinforce culturally appropriate and client-centered care. Also, ethical and technology oversight. So this will consist of proper handling of client data, informed consent, and then also any ethical dilemmas involving tech or client care, making sure they are addressed collaboratively. And then we'll also have supervision regarding ongoing training and peer support. And this will focus on cultural humility, reproductive justice, and professional boundaries. We'll also have supervision on advisory board consultation. So this would be a meeting quarterly to offer input on program effectiveness. And they'll also offer guide decision-making related to service delivery and community needs. Okay, and then looking at the timeline of their intervention in months 1 through 3, this will consist of secure funding and hiring the staff. We'll also establish community advisory board, and then we'll begin doula recruitment and app development. In months 4 to 6, we'll train first cohort of doulas. We'll finalize and test mobile app features, and we'll develop culturally relevant health education content. In months 7 to 9, we'll do a launch the pilot with 25 to 50 clients. We'll also begin virtual and in-person doula support, and then we'll collect early feedback to make any adjustments. Months 10 to 12, we will start enrolling full caseload, so looking at about 100 to 150 clients. We'll conduct first-year program evaluations, and then we'll plan for scaling in year 2 funding. Okay, and then lastly, we will focus on our outcomes for this intervention. Okay, so outcome 1 will be improved maternal and infant health outcomes. And there's a few ways this will be measured. One, will compare maternal and infant health indicators. Okay, we'll also track emergency interventions and maternal readmissions via client surveys and healthcare provider reports. Outcome 2, increase access to culturally responsive support. This will be measured a few ways as well by client satisfaction surveys at 30 days and 90 days post-birth. We'll also conduct qualitative interviews and focus groups with sample of clients and doulas. Our outcome 3 is enhance maternal health knowledge and self-advocacy. So with this, we will have pre and post program knowledge assessments. We'll have self-reported comfort with asking questions. We'll also create birth plans. And then we'll also have participation rates in educational workshops and use of app-based resources. And then a few more of the outcomes. Outcome 4 will be ethical, will be to ethical and secure use of technology. So we'll have ongoing audits. We'll also have tracking logs for any data breaches or client concerns. Outcome 5 will be community empowerment and capacity building. So this would be through number of doulas trained, certified, and retained. Again, we'll have an advisory board meeting participation and documented recommendations implemented. And then also increase in community-led initiatives or partnerships related to Black maternal health. And this is my reference for the statistic that I mentioned earlier with CDC. Thank you. Have a good day.